So first trimester, vaginal bleeding in pregnancy is a very common complaint that we see all the time in the emergency department. It can also be one that can be pretty uncomfortable to discuss with patients and challenging to know how to address it if it's something you're not as accustomed to, or if you don't already have some good phrases in your arsenal or kind of ways that you've practiced discussing this. So here's how I do it with my patients. Um, so first of all, make sure that they know they're pregnant. And if they don't, if you just diagnose them with that today, have that conversation first, and then say, bleeding in early pregnancy when you're in your first trimester or the first few weeks of pregnancy is actually really, really common. When they've studied it, about 20 to 40% of women will have that. And so meaning for every 5 women who are pregnant, like 1 or 2 of them will have bleeding in that first trimester. And there's a bunch of different reasons why this happens. Sometimes we never find out the cause. Sometimes there will be a small amount of bleeding, and then the woman goes on to have a totally normal pregnancy. That happens about half the time, and we don't ever find out what it was. But the number one things that we do get worried about when we have somebody come in with bleeding in early pregnancy is, could this be a sign that they're going to have a miscarriage, or could this be a sign of something dangerous, like even more dangerous than that, with like a what we call an ectopic pregnancy or a tube pregnancy, which you might have heard of, where the pregnancy is not actually in the womb or in the uterus, but it's outside of that, like in the fallopian, in the tubes on the side, and that can be very dangerous and cause women to bleed to death if it's not caught. So those are the things that we are going to check for today. So what we're going to do is we'll start with a regular ultrasound, kind of looking on your stomach to see if we can find, figure out that the pregnancy is in your womb or not, and we'll have a look. And if we're hopefully able to see it well, we'll then check and see, can we tell if there's, the early version of the placenta forming, or we'll see if we can actually see the fetus itself and see a heartbeat. If we see those things, then that's very reassuring that it's both in the right place, that it's not a tube pregnancy, and also that that you're not going through the process of a miscarriage completely yet, which would be very good, of course. If we can't see very clearly, sometimes if it's super early, we can't see very clearly from just looking across the stomach. And so if that's the case, if it's okay with you, we'll do an internal ultrasound or a vaginal ultrasound next, because that can sometimes give us a clearer picture of what's going on if we can't see with a regular ultrasound on your stomach. And what we're going to be looking for again is, are there signs of, first, is the pregnancy in the womb where it should be? Can we see that the baby or that the fetus is in there and that it looks normal? And then we'll also be looking and doing a pelvic exam, or having a look, kind of like when you get a pap smear, we'll have a look there and see, does the cervix look like it's open, which is the kind of opening to the womb? Does that look like it's closed, which it should be if you're having a normal pregnancy? Or if it's looks like a miscarriage might be starting, sometimes you'll see that cervix start to open up. So those are the things that we'll be checking for. And so we'll address kind of whatever the case may be once we've done those tests, and then we'll talk about it further. And then so end that conversation. So after you've done all your studies, if you really do think so let's say everything looks fine, you don't see anything, baby's in the right place, you see a fetal heartbeat, heart tones, everything looks good, then I'll kind of conclude this talk with telling them, thankfully today everything looks okay. The fetus is in the right place. It has a heartbeat. Everything is looking good. So we don't think that you certainly haven't had a miscarriage already. However, as I mentioned before, that bleeding in pregnancy can be a sign that a miscarriage might be coming soon, that it might happen in the future. And unfortunately, at this stage, we don't have any way to prevent that. There's no medicines to give. There's no treatments to do. They used to try bed rest for this. That doesn't change anything. That doesn't help or doesn't work at this stage, at this really early stage of pregnancy. The best we can do is hope that things will work well, and to check you if the bleeding becomes really heavy or if anything changes, to make sure that you're doing okay. And there's nothing that you've done wrong. There's nothing that you've done to cause this. Sometimes this just happens, and it's a sign that things, there's a million things that happen as embryos are developing, as the fetus is developing, and sometimes things just go wrong by chance, and it's nothing usually that the mother has done wrong. If anything changes, please come back. But as of right now, everything is looking good. And so kind of pause, come back to you guys. So again, emphasizing the lack of responsibility or kind of definitely making sure that you remove any sort of like blame, because often women, when they're coming in, if they knew they were pregnant already and they're coming in with this, or, of course, number one, concerned, is the baby okay? Are they going to be okay? But then they also want to know, like, did I do something to cause this? Am I at fault? What am I doing wrong? Am I eating the wrong thing? Am I doing the wrong stuff? Do I need to lie in bed for weeks and weeks? And the answer to most of those things is no. And so that's another thing that they're often concerned about to address with them.